Hello, everyone. Welcome today. My name is Saif Goubran, and my supervisor is Dr. Schroet. I'd like to thank you all for coming here today to listen to my presentation. Today, I'll be discussing a project that we just launched in May titled Evaluating the Interim Canada Dental Benefit. Before we begin, I'd like to acknowledge that the University of Manitoba campuses are located on the original lands of the Anishinaabe, Cree, Ojibwe, Dakota, and Dene people, and the homeland of the Métis Nation. At our lab, we're dedicated to investigating inequities in oral health care and closing those gaps, which is something really relevant to the project I'm going to be discussing today. What we're going to do is introduce the Interim Canada Dental Benefit for those of you that haven't heard of the program yet, and then introduce our project's methods, some highlights in the results, and then get into the discussions and conclusions. So the Interim Canada Dental Benefit is a federal program that launched just in winter on December 1st of 2022, and its goal is to improve access to oral dental care for low-income families. Families are eligible to receive funds from the government if they meet certain eligibility criteria. So if we're to look closer at this pamphlet that the government provided on their CRA website, if we're to look closer at the eligibility criteria, we see that children under the age of 12 are eligible. The family cannot have any private insurance. The family must have filed income taxes in the past 2 years and receive the Canada Child Benefit, and they must also meet the income cutoffs. So families can receive up to $650 per eligible child if they make a household income of under $70,000. And if families make just under $90,000, they're eligible to receive $260. So the family receives the money through their CRA account, and they're able to use these funds on any dental treatment or also oral health supplies like toothbrushes and toothpaste, and any excess money can be kept by the family. So the interim benefit, as we know it right now, is almost like a test drive. And this is before the more comprehensive program is set to launch on July 1st of 2024. So we at our lab are also dedicated to seeing through this more comprehensive program. And that's why we've launched this project, to investigate parents and caregiver, as well as dental personnel, views and experiences with the program. And our plan is to share our findings with Health Canada's Canada Dental Benefit Task Force through the group Healthy Smile, Happy Child, which operates out of our lab. So our project had 3 parts to this. The first 2 were quantitative, and the final part was qualitative. The first was a parent caregiver survey questionnaire. The second was a dental personnel survey questionnaire, and the final was a parent caregiver qualitative interview that we're not going to dive into just in this presentation. So looking closer at the parent caregiver survey questionnaire, we recruited parents and caregivers from clinics such as Access Downtown or Mount Carmel Clinic, as well as from previous studies. The one requirement was that the families were low-income families. They were invited to complete their surveys over the phone, and we inquired about their knowledge level about the program, their views and experiences applying, as well as any challenges they had with the Interim Canada Dental Benefit. We did something very similar for dental personnel. Dental personnel include dentists, hygienists, assistants, therapists, as well as receptionists. These individuals were able to independently complete the survey through the online survey platform Microsoft Forms, and they received the link to the survey through different organizations such as the Manitoba Dental Association, Dental Hygienists Association, Assistants Association, as well as on social media, Facebook pages and Twitter pages. And we inquired about the same outcomes, their knowledge level and understanding about the program, as well as any challenges they experienced with the Interim Canada Dental Benefit. And what we did with the parents and caregivers, as well as dental personnel, was have the survey questionnaires mirror each other. They mirrored each other in their sections. As you see on the screen, those are the common sections that we had in the questionnaires, and also in specific questions themselves. And you'll see why that's going to be really useful once we get to the results section. Taking a look at the kind of questions that we asked in the results. For the awareness section, we asked just about the same questions for both parents and caregivers and dental personnel. We inquired about eligibility criteria and individuals' satisfaction level with the information that they received. For the application procedure section, we asked parents if they had applied for the benefit and their experience applying, while for dental personnel, we asked if they ever encourage parents to apply and what they've heard about the application procedure. In terms of receiving the benefit, we asked parents if they did receive the funds or if they were denied, and also if the funds were sufficient to cover the dental costs for their children. For dental personnel, we just asked if the funds that their clients received were sufficient. In the using the benefit section, we asked parents if they thought that the benefit improved access to dental care and any ongoing barriers they continue to have. While for dental personnel, we asked if they thought that the benefit improves access to oral care for families. And in terms of challenges and suggestions, that's where it differed a little. It was more specific to each group. For parents and caregivers, we asked about criteria that they might want changed or other challenges that they have. And for dental personnel, we asked about their challenges promoting the benefit and with booking and payments. So before we get to the results, I'll say that we're going to show the results for the first 66 parents and caregivers, although we're currently actually up to 83 parent caregiver responses. And I'll be showing you the results for the first 210 dental personnel, although we're currently up to 294 dental personnel responses. So looking at the awareness section results from that, we asked parents and caregivers if they felt if the information the government provided to them about the program was clear. And just over 60% of parents agreed. 62% of parents said that they felt that the information the government provided was clear. But when we asked this question to dental personnel, we saw quite a large shift, where 70% of dental personnel felt like the information the government provided about the program was unclear. Also in the awareness section, we inquired about a specific eligibility criteria that was of interest. So for those of you that aren't aware, families with income and employment assistance, as well as non-insured health benefits, are still eligible to receive the funds from the Interim Canada Dental Benefit if they require dental treatment that isn't covered by those two programs. And we want to know if both parents and caregivers and dental personnel had heard of this criteria before. And we see that when we ask parents about income and employment assistance, or EIA, 65% of them were unaware that these families were still eligible to apply for the benefit. And when we inquired about families with non-insured health benefits, NIHB, 77% of parents were unaware that families with NIHB were still eligible for the program. And similarly, when we asked dental personnel if they were aware that families with EIA and NIHB were eligible for the program, 72% of dental personnel were unaware of this. In terms of the application procedure, of the parents that applied, 38% of them had applied for this benefit. And of the 38%, we see that just under 70% of them thought that the application procedure was easy, which is good to see. But we do see that 62% of parents that we interviewed hadn't applied. When we asked dental personnel if they had ever encouraged a parent to apply to the benefit, we see that 60% of dental personnel responded no, that they have never encouraged a client to apply. So looking closer at the 62% of parents that didn't apply, we asked them why they hadn't. And we see that the most common reason was this second last one here. They did not know about the program, and that's why they didn't apply. That was followed with parents knowing they didn't meet eligibility criteria, like having private insurance. Now, looking at the receiving the benefit section, of the parents that applied, we asked them if the funds that they received were sufficient to cover the dental costs for their children, and 90% of them responded yes, that they felt the dental costs were sufficient. However, when we asked dental personnel if the funds their clients received were sufficient to cover dental costs, 71% of them responded no. So we see that there's a difference between these two groups now. In terms of the benefit in practice, 100% of parents and caregivers feel like this benefit improves access to oral care for families. So this includes families that didn't apply, weren't eligible, or were denied. Still, 100% of parents felt like this program improves access to oral care. And we see that when we ask the same question to dental personnel, 71% of dental personnel agree that the Interim Canada Dental Benefit improves access to oral care for young children. In terms of challenges and suggestions, I'll split it up into specifically the parents and caregivers and dental personnel. So we asked parents and caregivers, apart from affordability, what other barriers do they face when accessing dental care? And we see that actually the most common barrier was transportation. So this can be using the public transit system or having their own vehicle. And parents expressed that specifically in the wintertime can become more difficult. The other two most common difficulties, apart from affordability, of course, were related to time. So that's taking time off work or the dental office closing after the workday. We also see that 100% of parents and caregivers would like the government to expand the program to children under 18 years of age. So that's suggestions that parents and caregivers have. In terms of dental personnel, we asked them what challenges they face when assisting their clients with the Interim Canada dental benefit. And the two most common reasons were a lack of practical resources to educate parents, as well as a lack of promotional materials in the office to give to parents or to help explain the program. Now, to summarize some of these results, in terms of awareness, we see that overall there was some confusion about some eligibility criteria, and that was specifically on the dental personnel side. And this may have resulted in decreased number of applications if parents didn't know that they were eligible. In terms of the application procedure itself, we see that of the parents that applied, they reported that it was an easy process. However, dental personnel were still unlikely to encourage a client to apply to the benefit. In terms of receiving the benefit, most parents that applied received it and even received the full $650. And while parents felt the funds were sufficient, dental personnel disagreed. And in terms of using the benefit, overall, it seems that both parents and caregivers and dental personnel agree that the benefit improves access to oral care. However, we see that families continue to face barriers unrelated to affordability as well. So in terms of suggestions, what we saw from the parents and caregivers was that they would like the program to be extended to children under 18 years of age. And based off of the results from the awareness section, we also see that both parents and caregivers and dental personnel would benefit from increased awareness and advertisement of the benefit. So overall, the benefit shows great potential to support low-income families in their endeavor to access oral care. And we see that this is true because families indicated that they'd be more likely to visit the dentist after receiving these funds. And what this can do is potentially shift the narrative from dental visits being treatment-based and coming in when children have pain or severe dental decay to being more preventative-based. And what this can do is possibly decrease the prevalence of early childhood caries, or ECC, which is dental decay in young children, as my colleagues will talk more about. The unfortunate reality still, however, remains that families that can benefit most from this program may not know that they should be applying based off of our results from the awareness section. I'd like to thank everyone for listening to my presentation today, and these are all of my acknowledgements. Thank you.